Hi, everyone. I'm Joan Casey, and I'm an assistant professor at the University of Washington School of Public Health. And I'm here today to present on a recent paper in the American Journal of Public Health that I published with co-authors Robbie Parks, Tim Bruckner, Allison Gemmel, and Ray Catalano. And this paper is titled Excess Injury Mortality in Washington State During the 2021 Heat Wave. So here's what I'd like to talk about today, briefly. I'm going to confirm with you that climate change is occurring. I'm going to introduce heat waves as an effect of these rising CO2 levels. I'm going to describe potential links to injury of heat waves. And then I'll explain the study that we did that looked at the 2021 Pacific Northwest heat wave and potential impacts on injury-related mortality. So the climate, of course, has always been changing, but what's happening now is unique, sustained, and a steep upward trend. So you can see what we know as the hockey stick graph here, and these are temperatures over time, and you can see this very steep recent upturn. And so the conclusion from the IPCC is that from a long-term perspective, the warmth of the last half century is unusual and rapid. So we've seen about a degree Celsius of warming from 1850 to present day. And this warming can in turn lead to heat waves. So I like this graphic because it explains how, I say a 1 degree Celsius increase in temperature. First, for those in the US, that's about 2 degrees Fahrenheit. So a relatively small absolute change in temperature can actually lead to a very substantial change at the extremes of the distribution. And so that's what you can see here. A relatively small change in the average can lead to much more extreme heat. And that's what we're expecting to see with increases in heat waves as the climate continues to change. And we know that heat waves are a major cause of hospitalization and death. We've seen this in several occasions. There was the August 2003 European heat wave where 35,000 people died. There was the 1995 Chicago heat wave with over 700 attributable deaths. And there was the 2015 heat wave in India where at least 2,500 people died. So we're interested in thinking about the relationship between heat wave and injury. So there are a few studies that have looked at this in the past. So this is work by Marshall Burke at Stanford, looking at the relationship between monthly average temperatures and suicide rate in the United States. And so his group found that a fairly linear relationship, that as monthly average temperature increased, suicide rates also increased. This has been essentially replicated in France, and this is a more recent article, but finds a similar finding that as temperature increases, the relative risk of suicide also increases. Now, Robbie Parks, who's also a co-author on the current paper, published in 2020 an article specifically looking at injury mortality in the United States. And here he was looking at annual temperatures. And so he found that there were additional deaths associated with years that were 1.5 C degrees warmer. And that was true across unintentional and intentional injuries for a range of injury types. And so these different injuries might occur and are plausible due to behavioral and physiological changes, things like changes in alcohol consumption when it's warmer, changes in driving behavior or levels of anger and despair, as well as an increase in swimming that can lead to additional drowning deaths. So let's turn to the 2021 heat wave. This heat wave spanned approximately June 25th to July 2nd, 2021. All-time maximum temperature records fell in 7 different states, And the hottest day on record in Seattle took place on June 28th at 108 degrees Fahrenheit. We honed in on Washington State for our study because of the relatively low prevalence of air conditioners in the state and generally unprepared infrastructure. It's usually fairly moderate temperatures in the Pacific Northwest and in Washington State in particular. And so we were worried that there would be a particularly severe impact from this heat wave. So we asked the research question, did excess injury death occur in Washington State during or shortly following the 2021 Pacific Northwest heat wave? Now, ideally, we would have a counterfactual Washington that did not experience the heat wave. And we would watch that Washington over time and see how many injury deaths occurred. We then go ahead and compare that counterfactual Washington to the Washington State that did experience the heat wave and see if the number of injury deaths differed. If they did, we could then attribute the excess injury deaths to the heat wave. But we do not actually have this counterfactual Washington State. So here we're going to instead use time series methods to estimate the number of deaths we would have expected during the heat wave. So in terms of methods, specifically, we relied on weekly nationwide death certificate data that spanned December 2013 to July 2021. And these included a manner of death classification. The CDC includes a natural death category, and that's defined as deaths due solely or nearly totally to disease or the aging process. And so the inverse of that would be unnatural deaths or injury deaths. From 2010 to 2020, injury or unnatural deaths accounted for about 11% of deaths in the United States. So that's the next subset. We identified all these injury deaths in Washington State, as well as the rest of the United States. And then we used time series methods. So we regressed the weekly count of injury deaths in Washington State on those in the remainder of the United States for the 390 weeks preceding the heat wave. And this allowed us to control for temporal variation in injury deaths, things like long-term trends. The number of injury deaths were increasing everywhere over time, or seasonality in injury deaths. We know that certain seasons have higher levels of injury-related mortality. And then we looked at the 6 weeks between the initiation of the heat wave and the end of July to determine if the residuals of our models were elevated above what we would have expected in Washington State, and therefore indicate that there was excess injury mortality during the heat wave. So what did we find? Average weekly injury deaths in Washington before the heat wave ranged from 56 to 154. And let's look at the trends, the raw trends in observed injury deaths over time. So on the top panel, you can see the entire United States. And I just have a vertical red line indicating the beginning of the COVID-19 pandemic. So you can see an increase there. And then on the bottom panel, you're looking at the Washington specific observed injury deaths. And you can see that quite substantial spike after the vertical red bar indicating the start of the heat wave on June 25th, 2021. Now, here are the results of the time series model. So the line indicates what we would have expected injury mortality to look like in Washington State over time, given past trends in injury mortality and trends across the United States. And then the dots are what we actually observed. And so you can see here during the heat wave, these dots are far above the expected values. And so this is how we concluded that injury death counts exceeded expected counts in the 3 weeks beginning June 21st and ending July 10th, 2021. Just to break this down explicitly, here are the estimated excess injury deaths across these 3 weeks. And so each of these estimates fell outside the 95% detection interval, which was 20 deaths. And in particular, I'll highlight the week of June 27 to July 3rd, where we estimated an excess of 93 injury-related deaths. So across these 3 weeks, we then go on to estimate that the Pacific Northwest heat wave in Washington state coincided with 159 excess injury deaths. Our study, of course, had some limitations. We relied on provisional state-level death certificate data that did not specify cause or location of death beyond the state where the death occurred. We weren't able, therefore, to look at subtypes of injury deaths, for example, drownings or opioid-related mortality, things that might have been of particular interest. We also know that certain subgroups may be at disproportionate risk to the effects of heat, including older adults, outdoor workers, and others undertaking strenuous physical activity in uncooled spaces. So future work may wish to build upon what we have done to look at subtypes of injury deaths and to assess potentially vulnerable subgroups. This is all in the context of the fact that we anticipate many more heat waves to come. So this is from a Nature review just last year, and they're projecting the number of days per year with maximum temperatures above 35 degrees C or 95 degrees Fahrenheit over the land under 4 levels of warming. The top panel being 1.5 degrees C and the bottom panel being the most severe 4 degrees C of warming. And so you can see many places on Earth would experience many, many additional days with maximum temperatures exceeding 95 degrees Fahrenheit. Fortunately, we do have some adaptation measures. This is a really nice paper that highlights many of those spanning interventions or adaptation strategies from the individual to building to landscape to policy level. And so we need to begin thinking more and more about how to implement some of these in cities across the United States as well as globally. So I'll end there and thank you very much for the opportunity to discuss our paper with you.